Thank you very much for asking me to speak. I think I mean that. Because we've had an interesting morning, particularly with the comments on commissioners. And when I saw the headline in your Homecare magazine this week, or this month, should I say, I kind of knew what the discussion would be about. And I kind of prepared for it, actually. I thought, well, here I come. I'm trying to do my best for commissioners and to open dialogue. And of course, when you're in a cricket ground, as Mike has already alluded to, I was thinking, well, are we going to be a bit like the Australian and English cricket teams, and are we going to go head-to-head at any point? But my approach to life, a little bit like Bob's, is always this one, actually, that wherever we are and whoever we are, actually, if we put our strengths together to think about identifying what the problems are and therefore what some of the solutions might be, we'll come to better outcomes overall. And our starting point, which actually we haven't heard a lot about this morning, is the people that we serve together. Because we've all got slightly different responsibilities and we've all got slightly different elements that get a system together to provide care for some of our most vulnerable in the country. And this is Elsie. I talk about Elsie quite a lot. Her needs are, she had a husband who was needing care at end of life. And she's actually helped us enormously in Leeds with our integration planning and the way we work together. But it's good to have people like Elsie in our minds, as well as people like Claire. And we've already had a discussion this morning about the difference between providing services for people who may be older and needing particularly intense personal care, alongside people who are younger, disabled, need care to help live the lives they want to lead as well, because everybody needs and deserves that opportunity. But when we're thinking about what the problems are, of course, we all look at things from a slightly different perspective. And I think naturally sometimes we tend to think about all the negatives and all the things that are wrong. I had a meeting with a carer last week actually, from an authority not Leeds, not even near to Leeds, from a good authority, an authority that pays well. And this carer has two profoundly disabled sons who live at home. And they are deeply concerned about the quality of care in this country at the moment, and they were coming forward with all sorts of ideas, and I think are going to meet colleagues from CQC soon too. But the sort of things they were saying to me was that they felt there was a lack of transparency with care agencies, including financial transparency. There was overcharging, there was failure to deliver the contracted services, including dropping shifts, and strong language like bullying staff and bullying service users, which is not anything any of us would want to support or feel was happening. Is that a commissioning problem? Is it a providing problem? What is the problem? How do we work to make sure that those sorts of things aren't happening where indeed they are? And we know they're not everywhere. We know there are some problems. If you're a provider, we've heard some of the issues around this morning, and I'm sure the issues will be around 15 minutes, 0 hours, travel time, costs, payments, the way commissioning, etc., etc. Again, I heard last week from a provider who told me that a commissioner landed on his doorstep and said they wanted to negotiate a 40% reduction in fees. And there was, not surprisingly, quite an argument. How ridiculous is that? But as you're thinking maybe from a commissioner point of view, you've got issues about the budgets, and you've got very real issues. 2 weeks ago, at this moment in time, local authorities are setting their budgets for next year. And 2 weeks ago, and we've already identified in Leeds probably £9 million of savings, that, how we can do that next year without an impact on service, because that's what is our absolute commitment. Not meaning not changing services, because obviously change is there, but not reducing volume and trying to improve quality. But our head of finance and resources came and said, look, we've got this and this issue that nobody anticipated. Sandie, I need you to find £2 million for next year. And by the way, the reports, the first reports that need to go to members need to be ready in 2.5 weeks. And that's a good authority with good financial management and stable staff. These are the sorts of things that are happening in local authorities at the moment, and it's just the environment that we live in. And good negotiators and good people who work together understand each other's environments when they come together to talk about it. And I suppose what I'm saying in terms of showing the elephant is the fact that it will help our discussions if we can really see what the problems are and try and have a look at it, because I'm quite keen to try and pin down how big the problems are. And I know David's got some, will have views on that in terms of the CQC angles on this. We're about to put our procurement survey out this year, try and find out from local authorities. Let's try and triangulate the information as to where are the serious problems and what are some of the solutions we can do about it. Because together, I think we need to, if you like, act as the prism, act as the people managing the needs coming through the system in the white light and turning them into the very beautiful colours that we need to do for personalised services for people who need our care and support. And that is easier said than done, isn't it? Because I don't think that any of us can do that unless we have an attitude of a shared endeavour of coming to this party. Providers have got a role, obviously the regulators have got a role, communities and local people have got a role in relation to how people live independently and well in their communities. And of course, councils and CCGs as the commissioners and the decision makers around priorities and all those things have clearly got a role. But it's our citizens in the middle that we need to keep our eyes on. And as we've said today, in terms of people have commented, it's the outcomes we need to achieve for those citizens that will help us to resolve some of the very real issues that we're all dealing with at the moment. So, my starting point is let's get some basics right. And as far as commissioners are concerned, we have a personalisation revolution in social care commissioning, actually, because in 1992, when we first started learning what commissioning was, because before then we tended to provide it all ourselves, and we certainly didn't buy from independent sector providers, we've been learning a lot about commissioning since 1992. But of course, in the last several years, we now have a market which includes self-funders. We have markets that are about joint commissioning with the health service, as well as local authority commissioning. And our relationship with citizens and having their engagement in terms of expectations, hopes and dreams, in terms of the services that they want, is an absolute starting point for us as to how we can move forward. Our models of care management are critical at the moment in relation to things like how can we, if we've got a cash-strapped world, reduce the transactional costs that are around? Have we got the slickest systems? But more importantly, how can we work better with our health colleagues across care management together? And how can we actually change the patterns of service delivery that currently exist? Because we know from the recent State of Health and Care report that's just been published, there are people languishing in incorrect places for their absolute care needs. And we know that actually the budgets aren't going to be squared unless we change the activity levels that are required. It's not about shaving the odd percentage here and there, although clearly people are having to do that and doing that, but it's actually fewer people requiring the sort of care that is currently being provided now, because they are enabled to live different sorts of lives and fitter lives and be more engaged with their communities and be part and parcel of recognising what the jargon would say, an asset-based approach to service, as opposed to looking at what people can't do all the time. But of course, also the requirement for good commissioners is about facilitating the market, thinking about how we do that. The fair, affordable price that I know is such a passion with yourselves, and rightly so, but how do we get those linked to quality and outcomes? And I'm struck by the questions about how we get outcomes-based commissioning, because some of you will know that where we would point to is Wiltshire in that regard, in terms of the road they've gone down in Wiltshire. And Wiltshire have gone from a multiplicity of providers of home care services to 4. Our procurement survey last year said that local authorities on average contract with 29 providers. So if local authorities go down what I think is a health language of outcome-based commissioning, which is actually provider-led commissioning, then we're going to be seeing far fewer providers. So is that the way we're going? I think there's some big questions that we need to address together. Clearly, we need to maintain the issue of monitoring, linking it to safety and quality, but also working very differently, I think, with partners, with providers, but also the CQC in terms of some of that. As we're developing our contracting mechanisms and frameworks, co-production should be an absolute given. We should have market position statements in every area that mean something, that aren't just a piece of paper, because we said we've got to have them. We should have market development forums where providers come together. How many of you meet with your commissioners regularly? About, well, yes, maybe a third, I would say, slightly more generously. But anyway, at least it's more than 2, so I'm pleased about that, but probably not enough. So we need to be developing those things. And the last thing I would say is around political engagement, because one of the things that we learned in Leeds, I know it wasn't about our home care commissioning, but it was about our residential commissioning, actually. But we're passing on that learning now to how we're going to redo our home care commissioning, is the engagement of elected members. Elected members make the decisions about the priorities in local areas. And directors of adult social care services and their commissioners, at their peril, don't explain to elected members the consequences of those decision-making areas. And actually, having relationships with elected members is important for providers as well as commissioners, through scrutiny boards, through cabinet members, through local members in terms of where they are. And I would be encouraging you, because it's members that make decisions ultimately in terms of these matters. And we included elected members in our discussions around fees and quality and how we're going to go forward, and had a really dynamic relationship between commissioners, people who use services, the health service, ourselves, and the politicians and providers, everybody working together on what did we want it to look like for the future. And I think that's really our aspiration that we should be looking for at local area. In terms of getting the basics, Mike, there's some key things for providers as well. And I don't particularly want to rush through all of these because, I mean, I hesitate to. I mean, I am actually a provider as well, but with a rapidly reducing portfolio of provision, but that's another story. However, we know that if we want to get the basics right in terms of provision, we need to be engaging the people who use our services, focusing on the outcomes they want to achieve, respecting dignity, choice, keeping safe, all those sort of really critical things in terms of respecting the services that we're giving to the people who receive them. But we also need to engage and treat our staff well. We need to invest in leadership training and development and be prepared to evidence the quality and demonstrate continuous improvement. Those are sort of, I think, givens as we're providers, but also be innovative. I think also that's a given for all of us at the moment. So will that be enough? Supposing we had a country full of brilliant commissioners and a country full of brilliant providers, will that be enough in our current environment to achieve quality and the increasing expectations that the public has of us within the public pound that's available to us and the money that's available from people who purchase their own care? And I have to say, quite honestly, my jury's out on that at the moment. I think the Care Bill is a fantastic piece of legislation in terms of policy direction and where people will want to go. Whether, in fact, it is funded sufficiently is something that we will have to see, and it's something ADASS is working closely with the government about and also with its members to try to identify the true costs of building in legislation that actually does increase expectations, and probably rightly so, because we all want to be part of a civilised society that does that, but part of a civilised society also that's prepared to pay for it. And so we will have to see. But if we do know that if we carry on doing what we've always done, we'll get what we've always got. And so we have got to build in new approaches and innovation as we move forward on this. And it's about radically looking at the way we perhaps deliver services as a provider, as well as how we commission them as a commissioner. It's taking on board the information revolution and citizen empowerment and the sorts of tools that they have available to individuals to make their views known about what's happening. It's being prepared to measure whether what we're doing is actually having the impact that's desired. Are we actually achieving what we need to achieve to help someone achieve the outcomes they want and need? It's about recognising people will have their own records in a very short space of time. They will be able to have on board what exactly has happened to them. It will be recorded and it will be, with their permission, shared. So there will be implications there in terms of how dynamic we can be with decision-making about people's care and support needs. We'll also have to have new models of system leadership. And I want to support what Sharon said about the fact that actually UKHCA, ourselves, Skills for Care, some of the representative bodies, CPA, Care and Support Alliance and so on, do meet regularly, and we do ponder and think about how we can be developing our agendas together. And I think we need to be pleased that, that those conversations are taking place, and I think is having some impact in some of the areas that we're working on. Because we know from today, we've heard about your toolkit on minimum wage, and obviously UKHCA are doing all sorts of things and bringing their jigsaw to the table, piece of the jigsaw, in terms of a solution, as well as obviously the fair costing model that's been done. We know CQC are radically revising the way they're looking at how they are part of the picture in terms of regulation. ADASS, we've heard a little bit from John Rouse about the sector-led improvement initiatives. There was a report yesterday published that 93% of local authorities publish local accounts. And those local accounts actually tell the public and the elected members and partners what they've done with the money that they've had in the year and what they've achieved and how they've done it. Clearly, those local accounts, apparently only a third of them mentioned their relationship with providers and the quality of the provision from the independent sector in their local areas. We've clearly got to develop how those local accounts really say what's going on in local areas, but they are a mechanism, and that local authorities are treating them seriously. We've got a use of resources toolkit that local authorities can use to see how are they using their resources effectively. Are they achieving the outcomes that they want? And in production as we speak, and in Bridget and Colin, no doubt's hands, there is a top tips for directors in relation to procurement that I'm wanting to send round in the context of this summer's discussions about what is happening in local authorities, that directors need to assure themselves that they know what's happening exactly in their areas and that they move in on terms of where things that are unacceptable are happening. However, we can all do our individual things. What will be significant is when we put it together, and that we're doing things across the boundaries together. And I'm pleased to say that we're doing that too. Last week there was a meeting with CPA and the Care and Support Alliance around developing some messages and working together pre-election during next year. The commissioning framework that has been so widely spoken about this morning, and there's a lot of expectations riding on this, but we're doing together in co-production. You know, there are a number of other developments. Yesterday I read a paper that had been written by ADASS and the CPA, Care Provider Alliance, around commissioning and re-providing specialist learning disability services. How great was that? I mean, it's a really good piece of work looking at how we can work differently together. And it's those sorts of opportunities I think we need to look for as we go forward in what, as has been said, is the most horrendous financial environment that any of us could ever dream about. As I say, my £2 billion, we're still thinking about it. I'm sure there will be some things. I hope it won't be about shaving here, there and everywhere. We will maintain our eligibility and we will maintain our support in preventative services. But we've got to, you know, we have got to find the miracles. The miracles are about actually helping people more appropriately in their care environment to make sure that the services together are targeted in the very best way and that we avoid as much duplication as we can, listen to people to help them to achieve the outcomes they want. Thanks.